Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about rehabilitation. We'll hear from three specialists who work in the field of rehabilitation about physical, occupational, and speech therapy and some of the specialty therapies available across the North Shore. So we'll start first with Mike McNeil. Welcome to the show.
Thank you. Good morning.
Really excited to have you here. Pleased to be talking about rehabilitation because I think that's an area of medicine that we haven't covered on the show before.
Right.
So why don't you start off, tell us a little bit about your background and what you do at St. Tammany Health System for therapy and wellness.
So I've been doing it for quite some time. Prior to coming to St. Tammany, I was involved mostly in private practice, and I've been with St. Tammany now for 5 years in the director position. So I'm director of outpatient rehab services for the hospital, and so that kind of covers a lot of different areas: physical therapy, occupational therapy, and speech therapy. So that's kind of what I'm over with the hospital.
Right, and so those three are kind of the major disciplines. So let's talk a little bit about what that means, physical therapy specifically.
Right, so starting off with physical therapy, so that's basically, you can be treating a orthopedic patient, so somebody that had a total knee replacement, somebody had a total hip replacement, somebody that's had back surgery, rotator cuff problems. We also treat pediatrics as part of our physical therapy department. Even things like little babies with torticollis, we can address that with physical therapy. So there's a lot of different things in the pediatric world that we can work with. With getting back to the adult side, we also treat a lot of neurological patients. So we have Parkinson's disease patients. We have a specific program for Parkinson's patients. It's called Big and Loud, and so that is a program designed specifically for Parkinson's patients where they come in 4 days a week for a month to address either movement impairments, difficulty with coordination, strength, and then the loud component is actually part of speech therapy, which we'll kind of touch on in a minute. And so, we also treat obviously strokes, brain injuries, multiple sclerosis, Guillain-Barré, ALS, many different diagnoses that we treat from a physical therapist perspective. With regards to occupational therapy,
yeah.
We treat a lot of similar diagnoses, not so much knees, hips, lower extremity joints. Occupational therapy doesn't address those. They tend to address more of the upper extremity, the arm, so hand and wrist, elbow, shoulder, things like that. Occupational therapists also work a lot with our neurological patients, helping them relearn or teach them how to adapt to their stroke. And if they have impaired movement of their arm, we teach them strategies to be able to do activities they used to do in a different way, whether it be with adaptive equipment, whatever the case may be. There's adaptive feeding utensils, adaptive reachers, all kinds of stuff that occupational therapy can teach patients to use to help them modify the way they perform in their activities of daily living.
Wow.
And then finally, we offer speech therapy. Speech therapy, obviously, no pun intended, kind of speaks for itself. But you're working on people that have speech issues, but that could be from a variety of problems. So, yes, it could be from a stroke. It could be Parkinson's, like I mentioned. A lot of Parkinson's patients have trouble projecting their voice, and so they need to work on increasing their volume. They can work with patients with vocal cord dysfunctions, and they can also work on patients having swallowing issues, which is a very common issue depending on the diagnosis of the patient.
There's a pediatric component for all three of those, physical, occupational, and speech.
Correct. So at our main clinic in Covington, we have little bitty babies coming in for therapy all the way up to 100 years old. So it's quite a variety of patients that are coming in. And yes, we do offer pediatrics for all three disciplines.
Well, and you mentioned the main campus there in front of Flower Estates near the hospital. So that's kind of the biggest therapy and wellness location. But you have other locations that are provided within some of the specialty areas that St. Tammany has around the service district.
Yes, we have a lot of specialty service lines, in a few different locations. So we have the main clinic by Flowers Estates. We have the YMCA clinic, which is a satellite clinic. We only offer physical therapy at that location. We offer what's called lymphedema therapy, which is part of physical therapy, and also pelvic floor therapy. Those service lines are offered at the Women's Pavilion. And we also offer physical therapy and speech therapy at the Cancer Center. Lymphedema and pelvic floor are two specialty service areas that are kind of unique. Not every physical therapy location offers that. Breast cancer surgery, and they have to have multiple lymph nodes removed. Lymph nodes are responsible for removing the swelling, so when those lymph nodes are taken away, your body can't drain the fluid as well, so your arm swells. So that's called lymphedema. And then pelvic floor treats a variety of issues, related to, could be postpartum, could be just as we get older, we start having bowel and bladder dysfunction, and then even certain cancer conditions can cause bowel and bladder dysfunction, and the pelvic floor therapist can address those.
Fantastic. Well, I know those are two of the highly specialized areas that you offer, but there's a new one called musculoskeletal ultrasound.
Correct. So yeah, so we've over the last couple of years, our physical therapists have been training in musculoskeletal ultrasound, and so what that is basically a tool, another tool in our toolbox that we can use basically to scan a joint. So it's very similar to when women are pregnant, they get the ultrasound for the baby. Same concept here, except we're doing ultrasound on the shoulder, the elbow, whatever, hand, wrist, to pick up any kind of issues that could be going on. If you have tennis elbow, it's a common thing. You can actually detect that someone has tennis elbow with an ultrasound. You can detect if someone has a rotator cuff tear with the ultrasound. So a lot of soft tissue pathologies can be picked up with the ultrasound. And so what that allows us to do, traditionally years past, a patient would come in, okay, we suspect diagnosis of rotator cuff, but they've only had an x-ray. So then we treat them for 4 weeks, see if they get better. They don't get any better. Then they have to go get the MRI, and that takes a couple of weeks, and before you know it, you're 2.5 months into this process and you're just getting an answer. With this, we can pretty much tell you right away, yes, you have a small tear, or no, there's nothing we're going to be able to do for you. We're going to refer you back to the physician right away. It allows the physician to get the MRI much quicker because they have, the ultrasound scans and pictures that show what's going on, so the insurance is more likely to approve it. It just expedites the care that the patient's getting, makes it much more efficient. And at the same time, even if there's nothing significant going on, it eases the patient's mind because, they don't know what's going on, and they might be worried they have a tear, and we can scan them and say, no, look, everything's fine, it's just tendinitis, we can treat you. So it puts the patient at ease, gives the doctor confirmation of what they were thinking. So it's a wonderful tool that we're excited to add to our service line. We're primarily offering that on the outpatient side at North Azalea and also at the YMCA. But also on the inpatient side, the physical therapists are also training to do that as well, to offer that in the emergency room as an adjunct to diagnostic services that offer the emergency room, again, to expedite the diagnostic process and the care that the patient's receiving.
So that's fantastic because it means between St. Tammany Health System and Ochsner that you have physical therapy, occupational therapy, speech therapy, and specialty therapies throughout the service district. So people in Mandeville, Madisonville, Covington, Folsom are going to find a convenient place that they can receive the care they need, and you all can do that in conjunction with the primary care and specialty care that's available at St. Tammany and Ochsner.
We also have a great collaboration with the Cancer Center, which opened last year. Especially the physical therapy side has just exploded with the patients that we're seeing over there.
Well, Mike, thanks for coming in and telling us all about it.
All right, I thank you for having me. I enjoyed it. Thank you.
Thank you. You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about rehabilitation. We'll be right back.